of this exceptional conference, I extend a warm welcome and enthusiastic welcome to this plenary session. We are privileged to have with us today the organizations that are at the forefront of controlling and shaping the field of radiology at the global level. The International Atomic Energy Agency, Human Health Division, the International Society of Radiology, the African Government's Office, the African AFRA, which is the African Cooperative Agreement in Science and Technology, and a leading national screening program in Europe. It's a panel diverse enough to suit this plenary session perfectly. Our main theme for this plenary session is to provide you with a broader view of radiology. We will explore the global landscape, shedding light on what's happening beyond our borders through our distinguished guests. At the end of this session, we have the privilege of benefiting from the insights of esteemed radiology leaders, our chairs, our panelists, Professor Fauzi, Professor Dayasti, and Professor Shinoda, who we will engage in an informative and enriching panel discussion. Dr. Fauzi, thank you very much for affording me the privilege of moderating this session, and I extend my heartfelt congratulations to all of you for the success of this conference, and my dear colleagues and friends from the General Directorate of Radiology, who have played a pivotal role in making this event as grand as it is today. Deep thanks for the usual support of the Egyptian Society of Radiology. Thank you all, dear distinguished guests, and let's make this conference another resounding success. Thank you very much.
Thank you, Professor Dina. I would like to welcome everyone. It's a great pleasure. Professor Dina always has the best intro ever in the world. I would like to announce the beginning with the first speaker, who is Dr. Miriam Mikhail, and she is the head of Radiology Department at the International Atomic Energy Agency. The Division of Human Health involves in the medical imaging implementation projects in over 30 countries on the IAEA image database, and is an editorial board member of the Journal of Global Radiology. Dr. Miriam is a founding commissioner of the Lancet Oncology Commission on the medical imaging and nuclear medicine. Her international radiology work history resides with two UN agencies, the WHO in Switzerland and the IAEA in Australia. She has previously served on the American College of Radiology Guidelines and Standards Committee and led RAD-AID International. Dr. Miriam was graduated from Mayo Clinic and holds active medical licenses in New York, Florida, and Minnesota. Dr. Miriam.
Thank you so much for this kind introduction. And might I add that my parents grew up here in Cairo, so it's very touching to be here. A special thank you goes out to the Conference Advisory Board, especially Professor Fauzi for this kind invitation, and among the conference faculty, Professor Dina Husseini. So without further ado, I'd like to go ahead and start. Please, there's my first slide. Thank you. On behalf of the IAEA team, thank you. United Nations Sustainable Development Goal 3 for health cannot be achieved without medical imaging, without what you do. But in the global health agenda, that has not figured prominently. The International Atomic Energy Agency, why us? We are an intergovernmental agency in the United Nations family. Our mandate is radiation applications for all peaceful purposes, not just atomic energy. So in fact, a quarter of our budget goes towards human health. Returning to Sustainable Development Goal 3 of the United Nations, look at all of these sub-goals. To reduce maternal mortality, think of maternal fetal imaging, neonatal and child mortality, infectious diseases, think of COVID and the complications in all of the imaging, non-communicable diseases, be they cardiovascular diseases or cancer, what they call road traffic accidents, all trauma. Again, imaging, universal health coverage as well. So some examples of our latest work, catalyzing global advancement. This book, Establishing and Improving Interventional Radiology, was just launched a few weeks ago. And here in Africa, the only countries we know of with interventional radiology are Egypt, definitely the strongest, South Africa, Kenya, Tanzania, Tunisia, Morocco, and very recently, just this past August, the first interventional radiology suite in Uganda. We have new IAEA-supported trainings in radiology. We are better known and have a more established history in radiation therapy and nuclear medicine, but are currently greatly expanding our support for radiology, mapping fellowships and subspecialties, for example, here in Africa to assess not only the needs, but find willing host facilities. For example, in the biggest public hospital, Kenyatta in Kenya, they have no subspecialty trained pediatric radiologists. So we have a proposed plan for this coming year to fund radiologists from Kenyatta to Egypt for a full year. Similarly, at the largest public hospital in Namibia, they have not yet established the capacity to perform stereotactic breast biopsies. So we are going to fund a mammographer to come here to Egypt, and we're very grateful indeed to Egypt. Professor Husseini and Professor Christiana Hertel here as well are working on a breast imaging free module that will be available over our IAEA Human Health Campus very soon. This is the Human Health Campus, and you see some of the free courses, for example, on nodes. And we also have enduring materials from our prior conferences, such as that on cardiovascular imaging this past December, which welcomed several thousand people. And we're looking forward to IPET, the Clinical PET CT conference in October 2024, again to welcome several thousand people and freely available online. We were very much a part of the WHO Global Breast Cancer Initiative framework published this year. The IAEA provided the UN leads of Pillar 2 on diagnostics and Pillar 3, and we are conducting workshops to implement the key performance indicators for countries of this Global Breast Cancer Initiative. Dr. Hanan Goefal is here. We are also conducting hands-on breast imaging training courses, including the procurement and gifts of breast imaging phantoms, such as you see here. This was a regional course, all Africa course in Addis Ababa recently. Stay tuned for more coordinated research projects. For example, this was a prior project with around 16 countries, one of them being Egypt, to show that we could make a measurable difference in terms of the detection and diagnosis of breast cancer in imaging. What gets measured gets achieved. And some of our imminent upcoming collaborations, we're sponsoring virtual attendance for over 250 participants to the Radiological Society of North America, as well as sponsoring several low and middle income participants on site in Chicago, those with abstracts accepted by RSNA. We're doing pilots, such as in the little island of St. Vincent, where we're procuring the breast imaging equipment, we're training people. We have a course coming up in collaboration with the International Society of Radiology and the Pan American Health Organization. We also have a radiology audit coming up in Jordan the week after next, and large scale courses we have planned with St. Jude on childhood cancer imaging and with MD Anderson on breast imaging. As well, we hope in 2024 it's proposed to develop with AFRA, I know Professor Husseini is very involved in this, to develop a strategy for enhancing radiology throughout Africa, akin to this document that exists for nuclear medicine, and we have a similar framework for radiotherapy. It's been a privilege to engage in such dialogues. This was a meeting earlier this year. You see some familiar faces, including of the European Society of Radiology and the International Society of Radiology. As well, we at the IAEA are very involved in drafting, we're a part of the drafting teams of national cancer control plans throughout the world, and we're integrating those metrics more and more for medical imaging. We also have impact reviews to assess cancer control capacity in countries, and two of the upcoming reviews are in Ethiopia and Guinea. In nuclear medicine and radiotherapy, we conduct conferences to harmonize curricular minimum competencies between countries to promote reciprocity of acceptance and licensure. We can do this kind of thing in radiology too, with your help. We have new data in the IAEA Medical Imaging and Nuclear Medicine Global Resources Database. If you're unfamiliar with this, please Google IAEA Imagine. For example, we were able to show that in high-income countries, roughly 25,000 inhabitants are served by one CT scanner, compared to 1.7 million inhabitants served by one CT scanner in low-income countries. As well, we have our flagship initiative, Rays of Hope. All of the first wave countries are here in Africa, and we are undertaking many new needs assessments in member states to help bolster capacity building for all of the multidisciplinary professionals in radiology. And since 2012, in nuclear medicine and radiology, we have engaged in over 500 technical cooperation projects in countries in 144 member states, catalyzing greater recognition that medical imaging should list among cross-cutting metrics for addressing global epidemiologic priorities, because Sustainable Development Goal 3 cannot be achieved without you, without medical imaging. Thank you.